Hello. My name's Reggie Gilstrap, and this is my wound care video. Knock, knock, knock. Hand hygiene. Provide for patient privacy. It's just me, the student nurse. Hello, Mr. Gilstrap. How you doing today? Oh, great. All right. Well, my name's Joey, and I'll be your student nurse for the day. So today, I would like to conduct wound care on your wound and change your dressing. It'll take probably between 7 to 12 minutes. Is that okay with you? Okay, awesome. Well, that's great. So before we get started, I'd like to ask you a couple questions. So can you give me your name and date of birth, please? Awesome. And do you have any allergies? No? No allergies. Great. So I'd like to assess your pain first before we get this started. Um, can you tell me on a pain scale of 0 to 10, with 0 being no pain, 10 being extreme pain, what level your pain is at right now? Okay, awesome. 0. That's really good. So if my patient's pain level was higher, to where it would impede the changing of the dressings, and it would cause extreme pain to my patient, then we would administer PO or IV medication depending on what the doctor has ordered my patient. And then I would come back and reassess my patient's pain level depending on how it was given. So next, the first thing that I'm going to do is I'm going to place my supplies on a clean surface. So I have this clean surface right here, and I brought with me a pad that I can use to place some of my stuff on. So I'm going to go ahead and place that down. And then I'm going to go ahead and place down my tools that I'm about to use. Alright, so I have those down. The next thing that I'm going to do is I'm going to go ahead and don clean gloves. But I'd like to do hand hygiene one more time real quick before I don my gloves. So hand hygiene, wash my hands. I don't have any exam gloves here, so in an actual setting I would have on exam gloves. So the next thing that I'm going to do is I'm going to go ahead and expose my patient's site. So there's my patient's site right there. So with the site exposed, the first thing that I'm going to do is I'm going to go ahead and I'm going to remove the gauze on top, the dressing, and then anything that's stuffed into the wound. So I'm going to go ahead and do that now. Remember, I already did hand hygiene, and I already put on my gloves. So I'm going to go ahead and dispose of this dressing in my biohazard bin that I have right here. Alright, and then I'm going to take out what was in the wound. Now what I'm going to do is I'm going to assess this wound. I'm going to assess the color, the odor, the consistency, the amount of anudate or exudate, if there was any that was coming out of it. So I assess that. Next I'm going to measure the wound. So what I'm looking for when it comes to measurements is the length, the width, and the depth of the wound. So I have this handy dandy measuring tool right here that'll really just give me, the size of the wound. So this wound is 9 centimeters. So I'm going to go ahead and get the width, the length, and then with a cotton swab, I'm going to do kind of two things. So I want to get the depth of the wound first. Dispose of that. Then I want to check for tunneling. So I'll check the edges. And then dispose of that. So I can go ahead and dispose of all that because I'm done with all the measuring that I need to do. So I have all the wound dimensions. There's no signs of eschar, and I assessed the tunneling with the cotton swab and got my dimensions. So the next thing that I need to do is I'm going to go ahead and take my gloves off, throw them away in the biohazard bin. I'm going to wash my hands again. Wash, wash, wash. After I wash them, I'm going to go ahead and get my sterile packages, open them, and get ready to dress this wound. So the first thing that I'm going to do is lay down my sterile mat. Make sure I don't touch stay within the 1-inch border. Alright. Dispose of that. I'm going to go ahead and open up my saline that I have right here. Pour a little bit out. Pour a little bit there. And then I'm going to go ahead and don my sterile gloves. When I don my sterile gloves, I'm going to use sterile technique. I'm going to kind of explain that because my gloves kind of ripped and it's going to be really hard to do it the correct way. But I would grab the underside of the edge of the glove right here. I don't want to rip it more. So I would grab the underside and push it onto my hand without without touching the actual outside. I'm doing it right now just to get it on because I don't want it to rip completely. Alright. And then with the same, using sterile technique, only touching the outside. Work this one onto my hand. And because this glove's clean, I can pull it up. Alright, so I don't have a syringe, but if I had a syringe, I would go ahead and draw up between 35 and 60 milliliters of saline. And what I'm going to do is I'm going to start irrigating this wound from the top and then soaking it up with gauze pads and throwing them away in the biohazard bin. Making sure that I don't cross my sterile field. And when I'm doing that, I'm going to keep irrigating that wound until it's clear. Once it's clear, I'm good, but I have to wait until it's clear, until the fluid is clear. So once it's clear, I'll pat with gauze to make sure the wound is dry. Wound is dry. Once that happens, then I can go ahead and pat the wound. Pack the wound. So now what I'm going to do is I'm going to go ahead and get my gauze. I have my cotton swabs. I'm going to go ahead and get a gauze. And pack this one. Then I'm going to stand away from my sterile field. Throw those away. Now the next thing that I can do is I'm going to go ahead and apply the dry gauze over the wound. Now earlier, I don't know if you saw, but these are semi-wet. So just a heads up. Without touching the inside of this dressing, because this is sterile, without touching the inside of the dressing, I would apply it, and then I can tape it. I have tape already over here because I didn't want to keep reusing tape and run out of tape. Alright, so once the dry gauze on top is secured, I can go ahead and take a piece of tape. I'll write my initials, the date, and the time, and then I'll place it right here on the side. Once I do that, I can go ahead and take off my gloves. Taking one off like this and sticking my finger underneath so I don't actually touch. Then I'll dispose of them in the biohazard. And once I do that, I can go ahead and get rid of my stuff. Alright, so I can go ahead and I'll conduct hand hygiene. Alright, I can go ahead and close this up. Raise my patient's eyebrows up, put the bed in the lowest position, make sure it's locked, make sure the call light is accessible. I want to do hand hygiene one more time. Then what I'd like to do is reassess my patient. Alright, sir, so now that we're done with your dressing change, can you tell me what level your pain is at now? 0 being no pain and 10 being extreme pain? 0? Awesome. Alright, sir. Well, that concludes your dressing change. Your wound looked good. It looks like it's healing well, okay? The tissue is granulated. It's nice and pink. It's looking good, okay? Do you have any questions? No questions? Well, thank you, sir. You have your call light. Call me if you need me. Your side rails are up. The bed's locked. It's in the lowest position. I'd like to thank you for allowing me to do this, and you have a good day, okay? Call if you need anything. And hygiene. And then the last thing that I would do after hand hygiene is documentation. I would write my patient's chart. So I would just include, wound characteristics, the measurements I got, whether or not there was any presence of drainage, wound care, the type of dressing type that I put on, and technique that I used, the quantity of dressings that were packed inside the wound, any education that I supplied to the patient, and their level of education on wound care. I would then sign or initial the document. And that is it. That's my video. Thank you.